Hello and welcome to the Oral Systemic Health Connection. We are a group of researchers from Dublin Dental Hospital and St James's Hospital investigating if bacteria found in our mouth and bacteria found in a diabetic foot ulcer are linked. We aim to investigate if bacteria can travel through our blood vessels, known as an oral systemic connection. We collaborated with Temple Carrick Transition Year class to explore ways in which our mouth is deemed to be a gateway to our general health. And we asked the class what problems can occur in our mouth. We had a mixture of responses, including cavities. Cavities refer to dental decay, which is caused by sugar in our diet. Scurvy. Scurvy is a condition that was common in the past, but not so much nowadays, and it's linked to a lack of vitamin C. Our primary focus today was plaque, bleeding gums, and gum disease. Dental plaque are the bacteria or germs that form on our teeth. It's sticky and often invisible to see when we are brushing our teeth, so it commonly gets left behind by accident. There's been lots of diseases associated with poor oral health, including heart disease and diabetes, to name just a few. But how are the diseases in our mouth linked to the diseases in the rest of our body? Plaque, or the bacteria in our mouth, cause our gums to bleed, known as inflammation. When our gums are inflamed and bleeding, the bugs or the bacteria can get into the blood vessels and can travel around the body, causing problems for our health in places like the heart or the brain, for example. So our teeth often appear clean on the surface. If we rush or don't brush properly, we can leave a lot of this invisible bacteria behind. So we looked at the same set of teeth 12 hours after not brushing, and we used what we call disclosing dye to show where the bacteria sit. You can see the common areas where bacteria sit, in between the gums and around the teeth where the gum meets. This disclosing dye can be brushed away and helps us to keep our oral hygiene measures to a good standard. So how should we care for our teeth? We recommend that we brush our teeth twice a day for 2 minutes. Flossing or other interdental aids should be used twice daily also. Change your toothbrush every 3 to 4 months or sooner if the bristles become worn. Manual toothbrush and electric toothbrush are both recommended. The important part is that your technique is correct. Your dental hygienist or your dentist can assist with this. It's important you visit regularly to maintain good health. The oral systemic connection has fascinated healthcare scientists for centuries. The first mention was as far back as 2,700 years ago. The most established evidence of poor oral health being linked to our general health include diseases such as diabetes, heart disease, metabolic syndrome, rheumatoid arthritis. But the research into this connection is ongoing around the world, and to date, oral bacteria has been detected in most body parts, including the spine, the brain, the gut, and the pancreas, to name just a few. So we looked at the implications of oral systemic health on our general health, and we brainstormed with the class in transition year about the possibilities of questions surrounding this. So would the same amount of bacteria form if we didn't eat? Well, studies have shown that there's approximately 700 species of bacteria in our mouth, but estimates suggest that there could be as many as 1,200. Bacteria is always in our mouth. Eating certainly helps it to build up into a sticky dental plaque, but we have to eat to survive. So by practicing good oral hygiene, we control the bacteria levels. So how do you track where the bacteria may go? It may be impossible to track bacteria until it reaches its final destination. Bacteria from our mouth has been found in multiple areas around the body, and research continues to investigate the journey it goes on after it leaves the mouth. Do different types of food cause more or less bacteria to form on our teeth? Well, certainly sticky, sugary foods mean that bacteria strains that cause tooth decay or cavities can cause more damage. They use the sugar to cause holes, and the stickiness makes it hard to remove. So how does flossing help? Well, flossing helps by removing food and debris that becomes trapped in between our teeth. If left in pace, these bacteria can cause decay or gum disease. So does research show any serious illness from bacteria travelling through our bloodstream? Yes. Research has shown that bacteria can enter the bloodstream after procedures like tooth extraction or professional cleaning as a result of poor oral health. Bacteria has been found as a result in the heart and can be involved in infections within the heart. So is brushing your tongue as important as brushing your teeth? Yes, we need to brush our teeth twice a day and clean in between, but we also need to brush our tongue or use a tongue scraper to remove bacteria and debris that may become trapped on the surface and to keep our breath fresh. So how long of not brushing your teeth before it gets serious? This will vary from person to person. Everybody has different risk factors. By maintaining good oral health and preventing dental diseases, we exercise prevention and we reduce the risk of it ever getting serious. So conclusions and reflections that we made. The students found it interesting to learn about their own dental health and to think how weird it was that certain parts of our body could be affected by simply forgetting to brush our teeth. We concluded that good oral care is important for good general health. Everybody can help with our research. We're running an online survey looking at diabetes and oral health. We're gathering information on the link below. By sharing the link below or following us on social media, you can help keep up to date with our project developments. A special thank you to Temple Carrick Transition Year Class of 2020 and to Mr. Wallace for the participation and collaboration on this project. And thank you for listening.